You crawl in bed after a long, hard day and pull the covers up and take one last sigh of relief, just to get a big whiff of cat pee. That's exactly what happened to me one time, and why would my cat, who's been doing so well, all of a sudden start using the bathroom outside of her litter box? Let's investigate. Hey everyone, I'm Dr. Holmes and welcome to another episode of Pet Doc Sherlock, where we help people solve the mysteries of pets. Now, in one of our previous videos, we talked about setting up a litter box and getting your cat used to a litter box, and I'd really encourage you to start with that video if you haven't already seen it. We'll put a link in the description to this one, and it describes how you can basically set up a litter box and get your cat to reliably use it. Now, if your cat has been using the litter box for quite some time without any issues, it can become kind of challenging to figure out why he's all of a sudden started going elsewhere. It's frustrating, it doesn't smell great, and we want to figure out quickly why they've changed their habits, not only to save you the frustration, but to also make sure there's not any health issues that might be going on. And inappropriate urination, or urinating in different places throughout the house, is one of the most common reasons cats are given up to shelters and rescue groups. And finding new homes for those cats is almost impossible. So again, we need to figure this out pretty quick in order to make sure that they still have a happy home with you. So the first step we need to take in order to solve this problem is to make sure that first and foremost, this is actually a urinary problem and your cat is urinating somewhere and not marking somewhere. Now, figuring out the difference between urinating and marking behavior is usually pretty simple. If you're finding the smell of cat pee on a vertical surface, so the edge of a couch or a chair or even the wall somewhere, then it's more likely that it's a marking behavior as opposed to urine, which you'll find on the floor, on top of bath mats, on top of towels, in laundry piles, on top of the bed. Places like that. So if it's a marking behavior, then that is also sometimes a challenge to fix. But the first thing we always look at is it an intact male cat? And if it is, then the first recommendation is always neuter that cat. If the marking behavior's already started, sometimes neutering is not going to stop it. So that's why we always recommend that male cats be neutered a little bit earlier to make sure that that behavior doesn't start to begin with. The other things you can try are placing feel-away pheromone diffusers throughout your house to see if it will calm that cat and prevent it from marking as well. Sometimes a cat gets stressed, you bring a new cat in the home and they start marking areas, and it just takes time for them to adapt. So those pheromone diffusers can sometimes really help. Now, if it's not on vertical surfaces and you're finding little puddles here and there on carpet and soft objects, then it's likely urine and your cat's urinating in other places. So now it's time to figure out why they might be doing that. So let's think back to that first video that I mentioned and think about our litter box. Is it in a quiet place? Is it in a place that your cat feels safe? Has anything changed about that place? Because remember, your cat was doing just fine before, but now she's venturing elsewhere to use the bathroom. So is it in a guest bathroom that now you actually have people over and they're using that bathroom? Is it in an area that there was something blocking the view and it's now been moved? Has anything changed about the box itself? Did you change the type of litter? Does the litter have a new scent? Or have you forgotten to clean the litter boxes often? Again, the golden rule of litter boxes is keep them clean. Scoop it out every day, because even though your cat may have been using it well and you're like, I forgot to do it today, it's fine, and you let that go further and further, eventually your cat may say, you know what? Even though it's clean here and there, I'm tired of going back and forth and finding it dirty once in a while, so I'm going to start going somewhere else. It sounds a little bit strange, but that's actually happens with cats. So make sure you keep that box clean. Make sure it's in a quiet place that isn't high in traffic and doesn't have any noise. And if you find that all of that is still true, then now it's time to look for some possible health issues that may be going on with your cat. And yes, that does mean a trip to the vet, and also probably means you're going to have to spend a little bit of money, but there's some pretty significant health issues that could be going on that you need to know about and you need to get on top of before they cause even more problems in the future. Now you've taken your cat to the vet and you're wondering what it is they're going to be looking for. Well, depending on the age of your cat and exactly what's going on at home, they may start in one place or the other, but the most common thing is just a simple run-of-the-mill urinary tract infection. Bacteria has gotten into the bladder somehow. It makes the bladder get inflamed and irritated, which makes your cat need to go to the bathroom more often, and it's kind of uncomfortable, so they are back and forth to the litter box, and then they start looking for other places to go because going to the litter box doesn't feel so great. And in order to find a urinary tract infection, your vet will likely try to get a sample of your cat's urine and run it through a urinalysis. Not only will that tell them if there's bacteria in there, but it'll give them a little bit of insight into how your cat's kidneys are working as well. If it is a urinary tract infection, they'll give your cat some antibiotics, and once those are through, your cat should likely be back to normal. If it's not a urinary tract infection, there are some other things that could be going on, and one of those is bladder stones. Bladder stones are not as big of a problem in female cats. They're still an issue, but they are a major problem in male cats. If you have a male cat, and he has been going back and forth to the litter box, and you haven't noticed much in the litter box when he comes out, or maybe just a dribble here and there, and now he seems to be uncomfortable, and now he's starting to cry out when he goes to the litter box, do not pass go, do not collect $200, go straight to your veterinarian. Male cats can be blocked by stones that they form in their bladders. They get stuck in the urethra, which prevents urine from going out of their body. If that goes on for too long, the urine just builds up inside of their bladder, filling it like a balloon, backing up into their kidneys, causing kidney damage, and if it goes even further than that, their bladder can even rupture, causing urine to go throughout their abdomen, which can be a life-threatening condition. So please, if you have a male cat who's been going back and forth to the litter box, isn't producing anything, please take them to your vet as soon as possible. Now, if they find some small stones, or it's a female cat, or something along those lines, they may try to dissolve those with a special diet, but often we end up having to go to surgery to remove those stones to make sure they don't cause an issue. And then after the procedure, your vet will talk to you about a special diet your cat should be on in order to prevent those stones from forming again. Now, not every cat's going to have an issue with stones, so not every cat needs to be on that special diet, and it's really just reserved for those who have had that issue in the past. So, they'll look for a urinary tract infection, they'll look for urinary stones, and then if they don't find either of those, they might start looking for other conditions that can cause them to urinate frequently. And some of those might be diabetes, because when blood sugar gets too high, sugar spills through the kidneys into the urine and pulls even more water with it. It basically makes your cat's bladder fill up faster, making them have to go to the bathroom more often. Or they may look for kidney disease itself. If it's an older cat and your cat's been losing weight, it's one of the first things that we tend to look for. And if the kidneys stop functioning appropriately, they basically just release all the water that comes to them through and into the bladder, which again makes the bladder fill up more often and makes them have to urinate more often. So those are the main processes that your vet will be looking for. There are other things that can cause your cat to urinate more often, but those are probably the most common issues that we see. Now, if you've thought about your litter box, and your litter box is just fine, nothing's changed there, you've taken your cat to the vet, and your vet says, you know, we've got a clean bill of health here. You might be left in the third category, which is just behavioral issues. And this can get pretty challenging and pretty frustrating, as I am very well aware because I have a cat with this particular problem. There is actually a condition or a syndrome for cats that have sort of behavioral urinary issues. One is called feline urologic syndrome, and the other is called feline lower urinary tract disease. Now, those are really long words, but they both indicate an issue with a cat where if they get stressed, their bladder tends to get inflamed. We don't exactly know why this happens, and it doesn't happen to every cat, but once that bladder gets inflamed, it triggers basically nerves to say, hey, I'm full and I need to go to the bathroom, when that's not necessarily true. So the cat starts going back and forth to use the litter box because their bladder's inflamed. Well, there's not much urine in there, so they keep straining and straining, and an inflamed bladder is a little bit more sensitive, so you may even start to see little blood drops in the litter box or nearby. And again, the cat's going back and forth to the litter box. It's not very comfortable, so now they start looking for other places to go. The only way to figure out if your cat has this issue, feline urologic syndrome or feline lower urinary tract disease, is to rule out the issues we've already talked about. Rule out issues with the litter box and rule out health conditions. When I discovered this with my cat, I had to do urinalysis, I had to do blood work, and fortunately I was around some ultrasound practice where I could have my cat practiced on by people learning to do ultrasound, and they didn't find anything wrong with her bladder. I discovered that it was just stress that's triggering it, and that can be kind of frustrating because you don't exactly know what's going to stress a particular cat. For mine, it was changes in her environment, so when we would move, when lots of people would be over for an extended period of time. And then once we were in a house for a while, she was just fine, and then I had some neighbors move in across the way that had outdoor cats. My cat stays inside. You wouldn't think that would cause a problem for her, but just seeing those cats through the window led her to get stressed, which led her bladder to get inflamed and led her to have the problem yet again. So, finding what is stressing your cat can sometimes be hard. It may not just be the nephew that's over there yanking your cat's tail. Obviously, that would be a stressor, but it may just be that you got some new furniture. You changed the candle that you typically burn. You changed the Febreze scent that you use. Who knows? It could be a number of things. But if you know there's no major health issue and you're having this problem happen here and there, then it's likely a behavioral issue and a stress issue. So the main things that I do to help my cat is I have pheromone diffusers, which basically release a calming pheromone that we can't smell and that other dogs can't smell or anything like that. And it basically just helps a cat feel calm. And I like to use something called Feel Away. You plug it in sort of like a Glade plug-in. Not a sponsor for this video by any means, but it's just what everybody knows them as, and you plug it into your wall, and it releases pheromones for a whole month, and then you can get refills as needed. The other thing that we can try is special types of food. Royal Canin makes a great food called Urinary Plus Calm. It contains components that help keep your cat calm and help them relax and prevent the stress from causing their bladder to be inflamed. So again, if your cat is urinating outside of its litter box, think about the litter box itself, first and foremost. Then, take them to the vet, make sure there's no health issues, and if it's a behavioral concern, just try your best to figure out how you can help your cat stay calm and relieve stress. And again, if it's marking behavior, spraying onto vertical surfaces, that's a separate issue. Could still involve stress, but you may need to neuter your cat. You may need to, again, involve some Feel Away pheromones or something along those lines, and think about different things that may be causing your cat to mark its territory. But I hope this video has been helpful. Please hit that like and subscribe button. Thank you for your time, and as always, work your best to keep your pets happy and healthy.